This is Morgan Atchison for FNP669, the head-to-toe assessment. For this assignment, I have to do it in the comfort of my home. I do not have an office or an outpatient setting to go to. I do not have an ophthalmoscope or an otoscope, but I will verbalize them during the presentation. My patient has requested to remain fully clothed during this exam.
Come in.
Hello, Mrs. Jane Smith.
Hey, how are ya?
I'm doing well. My name's Morgan Atchison. You prefer Mrs. Smith?
Yes.
Okay, like I said, my name is Morgan Atchison. Mrs. Smith, I'm a nurse practitioner student with Jacksonville State University, and I'm going to be taking care of you today. Is that okay?
Mm-hmm.
Okay. Just real quickly, if you don't mind me asking, what brings you in?
I've been having headaches.
Been having headaches, okay? So how long has these headaches been going on?
For the past couple of months.
Past couple of months, okay? And where are they located? Like the top of your head, the front of your head, the side?
The front.
The front of your head, like right here?
Mm-hmm.
Okay. And when they come on, how long do they last?
Usually a couple of hours, sometimes the whole day, sometimes it goes into the next day.
Okay, so anywhere from a couple hours to a couple of days, okay?
Mm-hmm.
Do they have any characteristics, like are they dull, sharp, throbbing?
It's dull, but it does throb too.
Okay, a dull, throbbing headache, okay?
Mm-hmm.
Anything that aggravates it?
Light makes it worse.
Light sensitivity, okay. What about that relieve it?
Nothing so far. I've tried to leave, but
it doesn't work, okay. So timing, how long? What is it? A specific time of the day when it takes place?
No.
No, okay. It just comes on, or do you have anything?
Sometimes my eyes start getting a little fuzzy, like my vision gets fuzzy before my headache, so I know they're kind of.
Okay, so you know it's coming on. Okay,
Mm-hmm.
and severity when you have one of these headaches on a scale of 0 to 10, how bad? 10 being the worst pain you ever felt. How bad does it hurt?
About an 8.
About an 8, so pretty bad pain. Okay.
Mm-hmm.
All right, Mrs. Smith. Well, I'm sorry you're having these headaches. Are you currently having one right now?
No.
Okay. If you don't mind, since this is your first visit here, I would need to do a head-to-toe assessment on you, okay, and see how you're doing from head to toe, and then maybe work on these headaches. Would that be okay?
Mm-hmm.
Any questions?
No.
All right. First thing is I've got to get a history on you. I've got to ask you a few questions. So, do you have any allergies?
No.
No allergies. No environmental food medication. Okay. Are you taking any medications?
Just the Aleve.
Just the Aleve. So, do you have any other illnesses like chronic conditions like hypertension, high blood pressure?
No.
Diabetes, nothing like that. Okay. Tell me about any last hospitalization. You ever been in a hospital?
Twice, just for having my babies.
Got 2 kids. Okay. When was that?
June of 2016 and May of 2019.
May of 2019. June 2016. When was your last menstrual period?
September of 2018.
So are you breastfeeding?
Yes.
Okay. Baby's healthy?
Mm-hmm.
Good deal. Were they vaginal or cesarean births?
Vaginal.
Everything went smooth, no issues there? Mm-hmm. Any other hospitalizations or surgeries?
No.
Okay. What about you got your parents? Are your parents still alive?
Mm-hmm.
How old's your mom?
56.
And how old's your dad?
59.
They have any health issues?
No.
Any grandparents still alive?
My grandmother.
How old is she?
90.
Is she having any health issues?
She's diabetic.
Diabetic. Okay, so she has diabetes. What about your other grandparents? Do you know anything about them? Are they still living?
No.
Okay. Well, any siblings, brothers, sisters?
I have one sister.
Okay. Any health conditions?
No.
How old is she?
25.
25. Okay. So the only thing we have is a family history of diabetes. Okay. What about? Can I need to ask you some social questions? Are you married?
Yes.
Okay. How long have you been married?
10 years.
Good deal. And are you currently employed?
Yes.
What's your occupation?
I'm a nurse.
You're a nurse. How long have you been employed?
7 years.
7 years. Okay. So you're a nurse. What's your highest degree of education?
Associate's degree.
Associate's degree. Do you exercise?
No.
Pretty stressful job. Any military background?
No.
Do you use tobacco, illicit drugs, or alcohol?
No.
No alcohol, because I know tobacco. Have you been out of the country within the past 6 months?
No.
Okay. All right. So I've got your history, and now we're going to move into the assessment phase. Is that okay? I have to ask you to do a few things. Any questions?
No.
Okay. Good deal. All right. The first thing that I'm going to do is I'm going to look at your head, and I'm going to just verbalize while I'm going through it to help me out. Okay. So I don't miss anything. All right. So I'm going to verbalize you. Your head is symmetric. Hair is evenly distributed. All right. I'm going to feel your scalp. Hair looks healthy. No lesions. No tenderness noted. Okay. All right. Now I'm going to ask you to raise your eyebrows if you can. All right. Now close your eyes. All right. Now smile without showing your teeth. Now show your teeth. All right. Now bite down. All right. Now try to open. All right. Good. Good. That's a 5 on muscle strength, which is normal. All right. So now I'm going to look at. I'm going to get you to puff your cheeks. All right. Now I'm going to start with your eyes. Do you wear glasses or contacts? No. Okay. So if you'll follow without moving your eye, moving your head, will you follow my pen light for me? All right. All right. So I'm going to look at your sclera and your conjunctiva. Sclera is white. Conjunctiva is pink and moist, which is good. All right. Now I want you to look at my light. All right, coming in. All right, pupils equally round, reacted to light and accommodation, which is good. All right, now I'm going to ask you to stand up if you don't mind. You don't wear glasses or contacts, you said?
No.
Walk over here for me, right here. All right, if you'll cover one eye. If you could read this line for me.
FELOPZD.
Okay, what about the next line down?
DEFPOTEC.
Okay, what about the one under that?
No.
All right, if you'll cover your other eye for me. Read this line.
FELOPZD.
All right, the next line.
DEFPOTEC.
All right, what about the next line?
No.
Too small? All right, if you'll come back and have a seat for me. Vision is 20/20 in both eyes. All right, this is where, and the point where I would do the ophthalmic scope exam. I do not have an ophthalmic scope, so I'm going to verbalize what I would do. I would get about a arm's length away. I would get you to focus on an object on the wall. Stay looking at that object. If I was doing her right eye, I would use my right hand. If I was doing her left eye, I would use my left hand. I would start about arm's length away, turn my light on. I would go in looking for the red reflex, and I would locate the optic disc. If I had trouble finding the optic disc, I would follow the vessels back towards it. I would do the same in both eyes. Okay? So the eyes look good. So now I'm going to start with the ears. All right? The ears are symmetric. Excuse me. The ears are symmetric. There's no lesions noted, no drainage noted, no tenderness noted upon palpation. All right, I do not have an otoscope, but at this point I would do the otoscope the same way I did the ophthalmoscope. I would use the right hand to look in the right ear, the left hand to look in the left ear. I would go in with the largest speculum that would fit comfortably. I would pull the ear up and back for an adult and go in and look for wax, any kind of irritation, redness, occlusion, foreign object. Try to visualize the tympanic membrane. It should be pearly white. I should see the handle malleus and a cone light reflex in both ears. All right. So we've done the ear exam. Now I'm going to look at your nostrils. Okay. Check for patency if you'll breathe. Again. All right. If I had the otoscope, I would take the largest speculum that would fit, that was comfortable. Look up, tilt the head back, look in the nostrils in each side. Look for any lesions. They should be pink and moist inside. Make sure there's no lesions, no drying, and no abnormalities noted. Okay, so the nostrils are good. Now I'm going to palpate your sinuses. Okay, if that's all right. Tell me if you have any discomfort. Any discomfort?
No.
All right. I'm going to percuss your sinuses. Any discomfort? No discomfort? Okay. How about if you'll open your mouth, stick your tongue out, and say ah? All right, tonsils are 0, which is normal. No gingivitis, no gum disease notice. Buccal mucosa is pink and moist, the way it's supposed to look. All the teeth are in and aligned as they should be. All right. Now I'm going to check your. I'm going to palpate for your lymph nodes. Okay. I'm going to start here. All right, no lymph nodes noted, which is a good thing. The neck is symmetric. Can I get you to swallow for me? Swallow. Good deal. All right, I'm going to, no masses or anything noted. Skin is appropriate color. I'm going to get you, I'm going to check your thyroid if you'll swallow. Again. All right. No issues noted with your thyroid. Okay, now that we've completed the head part of the exam, I'm going to move on to your lungs. Any questions? All right, if I can get you to turn around for me. All right. The skin, the back is symmetric. The skin has no nodules, no lesions noted, no abnormalities noted. All right, now I'm going to palpate. All right, and I'm going to percuss. Resonant, 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 dull, dull. Okay. Now, if you'll say 99 for me.
99, 99,
Again.
99.
All right, deep breath out and in. Again. Thoracic expansion is symmetric. All right, now I'm going to listen to you. With the diaphragm. The breath, just breathe. All right, again. 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 All right, if you'll turn around for me, back to the side. That's good. Breath. Another one. Another one. Another one. Another one. Another one. Another one. Respirations are even and unlabored. No accessory muscles being noted used. Respiration rate of 18. Okay, now if I could get you to lay back for me. All right, if you'll turn your head that way for me. Just going to look here. All right, turn back this way for me. No JVD noted. No pulsations noted. All right, if you'll go back the other way, I'm going to listen to your carotids. Diaphragm. Bell. All right, other side. Diaphragm. Bell. No bruise noted. Okay, I'm going to look at your chest now. Chest is symmetric. No scars or lesions noted. Healthy skin, healthy pigmentation noted. Hair is evenly distributed. All right. Check for pulses in both hands. Pulse is present. All right. Posterior tibial pulses. Present. Dorsalis pedis pulses are present. All at a +2. All right. And so now that I've done that, I'm going to press on your abdomen slash chest. No lifts or thrills noted. No heaves noted. Alright, now I'm going to listen with my diaphragm. Second intercostal space, right sternal border, will be my aortic. Second intercostal space, the left sternal border, will be my pulmonic. Fourth intercostal space, left sternal border, mitral. Fifth intercostal space, midclavicular. Tricuspid. Fifth intercostal space, midclavicular, mitral. Alright, I'll do it on my belt. Repeat the same process. S1 and S2 noted, no S3, S4 noted, no murmur noted. Alright, so we've done our cardiac, no edema noted. We've done our lungs. Now I'm going to look at your abdomen. Alright, so I look at your abdomen, it is symmetric. There's no lesions noted. Skin is healthy. There's no masses noted. No surgical scarring noted. So no abnormalities noted, just symmetric. Okay, now I'm going to listen to it with the diaphragm. Active bowel sounds in all four quadrants. Bell. No brewery or venous hum noted. Okay. Now I'm going to percuss. Tympani. 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 Dull. Dull. Alright, now I'm going to palpate the abdomen using light palpation. No masses noted, no abnormalities noted, no facial grimaces noted. Now I'm going to have to do some deep palpation. Let me know if it's uncomfortable. Deep breath in, out. Alright, again. Alright, over here. Alright, over here. Alright, no masses noted, no abnormalities noted. Alright, that's good for that. If you'll set up for me. Alright, now I'm going to check your reflexes. The first will be your bicep. If you'll just relax your arm. Alright. Just relax your wrist. Let's try it one more time. Alright. Do the same thing on this side. Alright. Now we'll do our patella. Alright. Now, let me check your capillary refill. Alright, Good, it's under 3 seconds. Good. All right, if you'll get up for me, you'll walk across the room and walk back this way. Deal. Steady gait. All right, if you'll turn around for me. All right, if you'll bend over. Spine is straight, no scoliosis noted, no kyphosis noted. All right, push back on me. All right, now bend forward for me. All right, if you'll turn back around for me. Raise your arms above your head. All right, down. Now with resistance. All right, down. Raise your biceps up. All right, down. Now with resistance. All right. Now if you'll raise your hands up, down. Now rotate them. All right. Good deal. Now let's do it with resistance. Push up, down. Now rotate them against me. Good deal. All right. If you'll do your finger, hold your arms up. Do your finger to your nose. All right. Do it again. Other side. Now do it. Get faster. All right. Good deal. While you're standing, if you can take your heel of one foot, rub it down the shin of the next leg and all the way down. There we go. Do it with both sides. Do it again. Good deal. One more time. Good deal. Okay. Now, you'll push up on my, there we go. Good deal. All right, if you'll sit back down for me, or lay back down. Don't flex your hips. Go up. Go out towards me. Back in. All right, push against me. All right, push against me. All right, let's do the other one. Let's go up. Out towards me. Back in. Push against me. Push against me. All right, good deal. All right, I want you to do your feet up and down. All right, push against me. Good deal. All right, full range of motion in all extremities. No crepitus noted. No abnormalities noted. Muscle strength is a 5 in all extremities. Everything looks good. All right, if you'll sit back up for me. All right, Mrs. Smith, everything looks good in the exam. What I'm going to do now is to see if we can help you out. I'm going to write you a prescription for Imitrex, 50 milligrams. Now, this is not a daily medication. When you start feeling the blurriness or the dizziness you said you had coming on before the migraines start, I want you to take one of them. It's 50 milligrams. If the migraine has not cleared in 2 hours, you may take another one. Okay, only take them when you get that aura, where I'm hoping this will help. I want to see you back in 2 weeks. If this does not help, we may schedule you an MRI. All right?
Okay.
Thank you so much for coming in.